Up next, we have Associate Professor Daniel Ting, Consultant, Surgical Retina Department, who will discuss preventing vision loss from diabetic retinopathy. Prof. Ting, please.
The control from my side. Hi everyone, can you guys hear me? Hi, is Daniel here? Hi, let's see whether I can share. Do I share my screen, right? Okay. Okay, morning everyone. Is Daniel here? Thank you for joining us in the National Eye Care Day. So this morning I'll be talking about some of the diabetic eye, the conditions. So my name is Daniel and I'm currently the Surgical Retina faculty in the Singapore National Eye Centre. Okay, these are some of the financial disclosure that I have. So I mean, a lot of people will ask, right, oh, what's diabetes? And this is a very common term. So essentially diabetes is the blood is, you know, when you go for a blood test and, you know, when the sugar level is detected to be high, people will start questioning whether this is related to diabetes. And the basic, the problem with the diabetes is the lack of the insulin level, or your body actually have increased resistance to, you know, the insulin level. So hence resulting in diabetes. So if you actually look at diabetes, what can diabetes cause in your body, you can actually broadly divide that to the small vessels problem, which is what you can see on the top left corner, called the microvascular complication, and the big vessels problem is called the macrovascular problem. So the small blood vessels actually can potentially affect your eye, your kidney, your nerve, and then the big vessels problem could potentially affect your brain, your heart, and also your extremities, which is your legs. So what is diabetic retinopathy? It is a disorder of the blood vessels in the patients with retina. In the next slide, I'm going to tell you what the retina is in your eye. And basically, it's a leading cause now. I mean, from the research we know, diabetic retinopathy is the major acquired visual loss among the working adults these days, especially in the developed countries. So what is the retina? Retina, if you look at the eye, I mean, you can see the diagram. The retina is the layer at the back of your eye that converts the light into the electrical impulse to be sent into the brain. So hence you can start making out, you know, the objects and things. You can read, you can see the colors and things. So this is what the retina does. And what causes diabetic retinopathy? I mean, we said before, diabetes is someone with a high sugar level. The high sugar level actually is quite toxic to the blood vessels. So when you have a high sugar level, I mean, your blood vessels will start undergoing changes. So it can cause tiny bleeding spots. You can have the proteins that actually leaks out from the blood vessels. And this in turn would actually cause the blood, the insufficiency of the blood supply to your eye, and then followed by the release of the growth factors that would actually cause the formation of the new blood vessels. And there's a few different types of diabetic retinopathy, and you know, in terms of the types, we actually can classify them based on the peripheral changes versus the central changes. So the peripheral changes, actually, if you break down to the two different big subtypes, is those who doesn't really have any abnormal vessels and those with the abnormal vessels. And for the milder forms, we can actually then further subdivide them into mild, moderate, and severe, and we call it as an MPDR. So proliferative diabetic retinopathy, I mean, is something that actually could actually cause the new blood vessels to form and subsequently cause the bleeding into the eye. That would actually cause instant blindness as well. And not only that, sometimes it can actually cause the scar to form and then hence also causing the retina to detach. And if you can see from the picture on the bottom part, I mean, the new vessels can also form on the iris that actually potentially can cause the glaucoma as well. And we talked about the peripheral retinal changes. Now let's go back to the central retinal changes. So the central retina is called the macula. So when we actually have the leakage of the proteins and the fluid into the macula, I mean, we call it as a diabetic macular edema. And essentially, if you have diabetic macular edema, sometimes when you see the objects, I mean, the sight of the object will be okay, but I mean, the central part you see is actually a bit blur, or sometimes even the line can actually be distorted. So can diabetic retinopathy cause blindness? I mean, the short answer is yes, but it's actually preventable by early detection. And people sometimes will also ask, like, how do I know if I have diabetic retinopathy? So, I mean, some of the symptoms, as I mentioned before, you can have central blurred vision. You can actually have different types of, you can even have floaters because of the bleeding into the eye. But the scary thing is that most people with diabetic retinopathy is asymptomatic. Hence, you're highlighting the importance of the early screening as well. So in Singapore, if you are detected with diabetes, if you're a subsidized patient, you will actually be screened in the polyclinic settings. And if you're in the GP settings, I hope like the GPs will also send the patients to the, to the eye specialist to actually check the eyes for any presence of diabetic retinopathy. So this is just an example to highlight that a patient's actually over the 6 years period going from no changes in the retina all the way because of the poorly controlled diabetic the sugar level, the blood pressure, cholesterol, and becoming the proliferative diabetic retinopathy. So how do we actually prevent this, right? I mean, if you actually look at the breakdowns of the population, I mean, most of the population, fortunately, do not have any diabetic retinopathy, and only less than 5 to 10% would have the more severe form of diabetic retinopathy. So, I mean, right now, I mean, the choices of screening can be a virtual screening where you actually go to polyclinic, and when they actually take the photos will be sent to the reading centers. And then someone on the other side could actually read the photos and determine whether you have presence or absence of diabetic retinopathy, and they will let the polyclinic know thereafter. So, I mean, this is one of the things that we actually do through the virtual telemedicine platform. You can also go to the GPs, or, you know, some of them would have the capability to check your retina using something what we call fundoscopy examination. And we have different also imaging modalities to screen for diabetic retinopathy as well. So this is the telemedicine platform that I actually just mentioned before. So it was actually started back in 2010. Right now, we are screening about 100 to 120,000 patients per year across the 20 primary eye care clinics. So this is just a workflow that I've just mentioned before. The photos will be taken in the polyclinic, sent to the reading centers. You'll be read by the graders, and then the report will be sent back to the clinicians. So we actually published some of the papers as well to actually highlight the performance between the professional graders that we've trained that underwent the very strict accreditation process to be certified to be a graders. We found that the performance itself is actually much better as compared to the physician who haven't actually undergone the eye training before. So this is one of the papers that we show that the sensitivity actually is up to 95 to 96% when we actually compare that with the retina specialist grading. So, I mean, right now, Singapore is actually marching towards a smart nation. We are actually talking a lot about AI, digital innovation and stuff. So, I mean, 7 to 8 years ago, this is a multidisciplinary team that led by myself and Professor Tian Wong, together with 30 over international colleagues to actually see how we could actually potentially adopt artificial intelligence and using the deep learning technique to screen for diabetic retinopathy. So the result itself actually was, to our surprise, I mean, the machine actually is performing as well as compared to the human graders when we actually screening for diabetic retinopathy. And this is another types of the retinal cameras that we can actually use to actually screen for the diabetic eye problems without actually having your pupils to be dilated. Yeah. So I'm sure some of you actually have been to the eye clinics before. You realize that once your pupil is dilated, essentially you can't check your WhatsApps, you can't actually scroll through your Facebooks or Instagram because your near vision will be extremely blurred, and it takes like 4 to 6 hours for your eyes to actually recover. And this is another types of the imaging devices that we use. It's called the OCT, optical coherence tomography. This is some of the pictures that we use to take to see whether you actually have any swelling, especially in the central part of your retina called the macula. So who are at risk of developing diabetic retinopathy? Right? Essentially, all diabetics are at risk, right? And we know there's certain risk factors that will actually make us extra, concerned about the subtype of patients. Basically, if you have a long-standing of diabetes, and essentially more than 10 years, usually we'll be very careful when we actually look into the eyes to check for any subtle changes in the retina. And for those who have a poorly controlled diabetic, right? So right now we always ask for your HbA1c, which is an average sugar control over the 3 months period. Usually we like to aim for between 6.5 to 7. So when you come to the clinic, we'll say, oh yeah, how's your sugar level and things like that. And the numbers, the good numbers is in the mid between the 6 and the 7%. So these are some of the things that for those of you who are actually diabetes, you have to be very, very careful about. So what can I do to prevent that? I think first, you have to actually control your, food intake, modify your, lifestyles and blood pressure, reduce your salt intake, exercise. Now COVID setting, a lot of the, us are homebound essentially, right? But I still would encourage the audience to really take a few more steps and, and that really not just for the physical health, but also for the psychological health is actually quite beneficial as well. And for the blood pressure, high cholesterol, and those who who are actually smoking, I think that's something that you really have to seriously think about, because this is not just endanger your health, but also your family members through the secondhand smoke as well. So is treatment necessary? I think for the eye wise, for the milder form, usually we just need to screen and monitor. But for the more severe cases, usually we need to then start thinking about the lasers or injections, or the worst case scenario, surgeries. So basically, laser treatment is, if you can actually see in the photos, this is the end results that you will be seeing. If you actually need the laser, so strongly advise the audience that if you can help it, please do not let us laser your eye, because this is not something that you really would enjoy. Especially during the laser session, because you'll be feeling the pain and stuff. But if you really have to do it, then no choice. We have to actually perform that to actually prevent visual loss as well. So prevention is always better than cure. So this is something that I would like to emphasize again and again, when I actually talk about this lecture. And the intravitreal injection, this is one of the newer form of treatment that has been first introduced about more than 10 years ago. That has actually really revolutionized how we actually treat some of the swelling inside the eye. And basically it's about a 10 minutes procedure where we can be actually done under the topical anesthesia on the same day as well. In some of the settings, yeah. And how can the treatment, what can the treatment achieve? Basically, we would need to actually prevent the further complications from occurring, and most importantly, to actually preserve your vision. And some of the vision, unfortunately, if the vessels has undergone some the damages, and some changes can be irreversible. So again, very important to actually make sure that you don't actually to control your sugar level to prevent the very disastrous complications. So this is my last slide. Prevention is better than cure. I know I've mentioned this more than 10 times in my lecture, but I hope really this is actually just give you a heads up about what are some of the the types of diabetes that we are seeing, and how the diabetes can affect the eye. And if you have diabetes, please attend your yearly eye checks in your polyclinics or your GPs. And of course, any problems, please come to SNEC to see us as well. I thank you for your kind attention, and happy to take any questions if you have. Okay, let me check the Q&A box now. Where do I start? And to see which questions is for the previous speaker and which question is for myself. To the bottom, let's see. Where is it? Chat or Q&A? Here is it. Okay. open. Is it here? Is it correct? No. 1:47 a.m. Or this one. Do you have any? Okay, we have one question. Do you have any tips of encouraging buy-in from the elderly on preventing diabetic retinopathy? Hasn't been easy telling my parents to change long-term habits, smoking, eating unhealthy hawker food, and without being dismissed. So it would be great if you can some advice on how to better convince them. I think it's $1 million questions, right? I mean, those are the things that your family members is always the harder customer for anyone to convince. You know, I said that it's because everyone has family members, and we know how hard sometimes it's actually to communicate some of the information to your parents. But I think having external sources it will help. And when you actually bring your parents to see doctors, I think that's another opportunity for someone else to actually tell them without you needing to do it. And if you actually have the chance to really provide the domestic helpers to your parents and things, I think some of the the lifestyle modification, you can actually start with just your dinners, your lunch, and that you're cooking at home. Of course, when you want to eat out and things, and just give them a reminder. I think don't give up, and then it's always really important to just we call it Chong-Hei, right? I mean, long-winded and things, but sometimes you just need to keep doing that over and over again. So I mean, those are the things that I think is really important to not to give up your parents, especially because if they actually unfortunately suffer from any complications, then it really is not just problems anymore; it's the whole entire family problem. So yeah, so keep on trying. That's what that would be my approach. And there's another question. I'm not diabetic, but detected as having epiretinal membrane on one eye. What must be done to prevent further deterioration? So I mean, epiretinal membrane is also part of the surgical retina condition that I manage, and it can also be divided into some of the elderly changes, the age-related changes versus the secondary causes. So it really depends what the epiretinal membrane is due to. That's the first point. Second point is whether actually how bad is your epiretinal membrane. So if it's very mild, a lot of my patients, when they come back to my clinics for 5 years, 6 years and things, and the epiretinal membrane just stays there and without causing any problems. So I mean, less than 5 to 10% of the epiretinal membrane needs to be actually dealt with, especially those, when your vision is being affected, or your central vision, your line, when you see the straight line, it becomes wavy. Those are some of the indications that we'll start the discussion with the patient whether he needs a surgical intervention. Yeah, so those are the things that I would say. I mean, some of the approaches that we'll do for epiretinal membrane. Okay, let me go to the next question. Where is it? Special supplements to prevent disease diabetic eye. Okay, actually, a lot of patients ask me, well, what can I take more? Sometimes I tell them less is more. So how do I do less? So less sugar, less salt, right? And actually more physical activity. So you don't really need any special supplements to do that. So the fruits, vegetables, and healthy lifestyle. Go for a walk, after your meal, and simple things like that actually is really sometimes very adequate. So I mean, of course, you want to go gym, you want to go run, I think that's even better. But I mean, sometimes when you actually talk about the lifestyle modification, it also has to be very sustainable. Sometimes you have just an urge to actually go hit the gym for 1 month, but then because of your work and your lifestyle and things, that the next month you say, oh, I can't actually do it. So you also have to kind of, in a way, modify your schedule and make sure that it can be also sustainable when you actually do it. So those are the things. We are playing a long game here, right? We're running a marathon, not a 100 meters sprint. So those are some of the analogy I usually like to share with my patients. How do you actually make sure that you fight these diabetes? I mean, especially when you have diabetes, this is a lifelong battle. So how do you actually come up with a sustainable strategy? This is something that's really important. Yeah. And what causes retinal detachment? Okay, so this is an entirely separate talk, and I welcome you guys to join my next talk on retinal detachment in another platform. But the retinal detachment from diabetes, however, I mean, it's because of the scar tissue most of the time. So when you have a new vessels, when you have a new vessels, what happens is surrounding the vessels, you also have the supporting tissue, the connective tissue. So when over time, sometimes this scar tissue can form and then to actually create pressure on the retina. If the retina sometimes is undergoing a lot of pressure, sometimes it can even cause a tear or a hole in the retina, causing something what we call rheumatogenic retinal detachment. So those are the things that is a mechanism how diabetes can cause retinal detachment. But of course, in a highly myopic population, there's also another mechanism how the retinal detachment can cause. Yeah. So I mean, I'm very on time. So I was told that I should end my talk. It's really glad to see so many people are here today asking. It's so interactive, and I hope I mean we can actually see you guys. I mean in a good way. I mean in SNEC and in a more public the forums in the future. Thanks once again for your attention. Thank you.